Age affects fertility, and age affects a woman's eggs more than any other factor. A woman is essentially born with all of the eggs she'll ever have, and at birth that's around 1 million eggs. During the course of her lifetime, she will lose eggs through the process of atresia, which is natural cell loss, as well as ovulation. As a woman ages, the loss in egg supply will translate into a decreased chance of fertility and a decreased chance of pregnancy. In addition, as the eggs sit in a woman's ovary, they have a higher chance of undergoing chromosomal changes. These chromosomal changes and abnormalities result in a decreased chance of fertilization. And the abnormal eggs that do fertilize have a higher chance of miscarriage and potentially abnormal pregnancies. And so the younger a woman is, the greater her number of eggs and the greater the quality of her eggs.
How is your ovarian reserve? Ovarian reserve is going to tell us how many eggs you're likely to make when you do an IVF cycle. We like to get a hormone called AMH. This hormone can be obtained any day of the cycle, even if you're on birth control pills. And AMH kind of tells us a number. We love it above 1. And this number tells us how many eggs you're likely to have and to be stimulated on an IVF cycle. Our third feature is our FSH, which is a classic hormone that we obtain on day 3 of the cycle. The FSH we'd like below 10, and that hormone also tells us how well you're going to do. Lastly, on ultrasound. When we ultrasound your ovaries, we can look at something called antral follicles. Antral follicles are 5 millimeter follicles that each have an egg in them. So the more of those little follicles, each with an egg, the more eggs you're likely to make.
In a natural cycle, one egg will become dominant and will ovulate, while the other eggs that are recruited will die off. Our goal in the egg freezing cycle is to salvage those eggs. And the way that we do this is that we have a woman administer to herself much higher levels of hormones, much higher levels of these gonadotropins to stimulate all of these follicles, all of these eggs to develop.
After the follicles are the right size, is taking a special shot later in the evening that day, and that matures the eggs and gets them ready for an egg retrieval. Egg retrieval is a very easy process. It's done under IV sedation, very simple anesthesia, and during that process we utilize a vaginal probe. Needle goes behind, and the needle actually goes into each of these follicles, and we remove the eggs.
Once an egg is taken out of a woman's body, the egg can be frozen, and that egg will no longer age, meaning that the egg that would have been lost through the process of atresia, the natural cell loss, or the process of ovulation, won't be lost because it's frozen. In addition, that egg will no longer undergo chromosomal changes or chromosomal abnormalities because it's frozen in time.
So once we have the eggs, it takes about 15 minutes, we're done. You're going to wake up real quickly and recover. And what are we going to do? We're going to secure these eggs. Take a look. Here you can see a picture of an egg, and the egg has cells around it. So we have the egg and nurse, or what we call cumulus cells. We would love you to have at least 12 or 13 eggs at the time of retrieval. That number really depends upon your ovarian reserve.
The younger a woman is, we get a greater number and a greater quality of eggs. However, this does not mean that an older woman couldn't or shouldn't freeze her eggs. It just may mean that she may need to do a greater number of cycles of egg freezing to get that same number and same quality as she would have compared to a younger woman. Most women feel fine after the procedure. Usually the day of the procedure, people can feel kind of groggy from the anesthesia. So we usually tell people the day of the procedure not to go to work and not to drive and just to rest. By the next day, most women feel fine and feel good enough to go back to work. Some women will feel crampy after the procedure, but things like an ibuprofen or a Tylenol can really help with that discomfort.